the Serum Institute of India has reduced the price of the Covishield vaccine that it is supplying to states from the previous 400 rupees to now 300 rupees per dose, effective immediately. The tweet that was put out by the Serum Institute of India read, as a philanthropic gesture on behalf of Serum Institute of India, I hereby reduce the price to the states from rupees 400 to rupees 300 per dose, effective immediately, said Adar Poonawalla in that tweet that he put out. This will save thousands of crores of state funds going forward. This will enable more vaccinations and save countless lives. So as a philanthropic gesture, says Adar Poonawalla, the Serum Institute of India has reduced the vaccine price for states. Remember, the vaccine price for the government of India, the central government, continues to remain at 150 rupees. It is going to be supplied now at 300 rupees to the states. Vishnu Shom joins us with the very latest. Vishnu, what more can you tell us?
Well, this is an important step at a time when many felt that the twin pricing policy, which actually existed as far as the dissemination of vaccines in this country was concerned, was adding to an element of confusion, and there was several state governments who said that it was a severe drain on them at this juncture for vaccines to be priced at 400 rupees to state governments, and they said that there needed to be one price. If the center was getting it at 150 rupees, and that remains the case, then states should be given that as well. However, now what the Serum Institute of India has done in a philanthropic gesture, they have cut down the price by 100 rupees. So from 400 rupees a dose to states, it's now gone down to 300 rupees. I should add that as far as private hospitals are concerned, they remain more at 600 rupees a dose of Covishield. That is the case across the country. The argument being that if you can afford it, then you should be able to afford this price in private hospitals. So this is a move that affects state governments, with state governments now getting the vaccine at 300 rupees. Private hospitals will continue to get it at 600 rupees, and the center will continue to get it at 150 rupees. This is exactly half of what Bharat Biotech's Covaxin and presently costs. Covaxin available to state governments at 600 rupees as opposed to 300 rupees over here, to private hospitals at 1200 rupees as opposed to 600 for Covishield, and for exports Covaxin is available at $15 to $20 a dose. That price is more than what the AstraZeneca vaccine is in many parts of the world. So whether this will be followed by a move from Bharat Biotech remains to be seen, but it certainly does bring an element of relief. But more importantly, I think what really everybody wants to know and focus on is when will the actual ramp up, which the Serum Institute has promised and which Bharat Biotech has promised, will that translate into many more doses on the ground? Because remember, 18 to 45s get their vaccines. They can get their vaccines from the 1st of May. In fact, the registration, as you know, on the CoWIN site opened earlier today. So that ramp up is very important, and the hope is that would actually happen, so that not just state governments, not just the center, but also state governments and private hospitals get the number of vaccines that they need.